Module 7, Objective 8, describe the structures and functions of the parasympathetic nervous system and discuss parasympathetic neurotransmitter release and their effects on target organs and tissues. 75% of the parasympathetic outflow travels via the vagus nerve, and we can see that right here. The remainder travels via other cranial nerves generally, with a few structures innervated by just pelvic nerves. But 75% travels along the vagus nerve. Major effects of parasympathetic division include a constriction of the pupils. It's going to increase digestive gland secretions, increase hormone secretions associated with nutrient absorption and utilization, as well as changes in blood flow and glandular activities associated with sex. Other effects of parasympathetic, it increases the smooth muscle activity along the digestive tract, therefore increasing motility. It's going to stimulate and coordinate defecation. It's going to stimulate and coordinate defecation. It's going to contract the urinary bladder during urination, constrict respiratory passageways back to rest, and it's going to reduce the heart rate and the force of contraction of the heart. There are a couple receptor types found within the autonomic nervous system worth mentioning. The first is the nicotinic receptors. These are found on ganglion cells of both the sympathetic and parasympathetic divisions, and they also occur at the neuromuscular junctions of the somatic nervous system. Exposure of these nicotinic receptors to acetylcholine causes excitation of the ganglionic neurons. Nicotine also binds these nicotinic receptors, and they can cause a fake sympathetic or parasympathetic activation. By fake, I mean nicotine binding these receptors can induce vomiting, diarrhea, high blood pressure, rapid heart rate or tachycardia, sweating, profuse salivation, convulsions that can lead to coma or death. It would take about 50 milligrams of nicotine in order to cause a lot of these symptoms. We're finding more and more patients are reporting to emergency departments with symptoms associated with nicotine poisoning. In the past, while nicotine is a chemical found in many tobacco products, these types of overdoses of nicotine were quite rare. There were the occasional case of nicotine absorbed through the skin of a gardener who was using nicotine as a fertilizer, but otherwise it was relatively rare. Today, we have a lot more cases of nicotine poisoning, and a lot of this is due to smoking cessation products. So people who want to quit smoking, sometimes they wear patches which have concentrations of nicotine that are absorbed through the skin. They may chew nicotine gum, and then they're smoking on the side. So they can get rapid heart rate, tachycardia. They can start sweating. Convulsions and comas and deaths are relatively rare, but they can experience some of these symptoms. Another product is with vaping. Normally, when a person smokes a cigarette, they know when they finished because the cigarette is gone. But with vaping, often kids, adults, they can overdo it because they don't have that sense of when they've completed a cigarette. In addition, you can buy cartridges for vapes that have different concentrations of nicotine. So if the concentration is high and the person is repetitively using the e-cigarette, then they could also experience some nicotine poisoning. Muscarinic receptors are another receptor found within the autonomic nervous system. They're found at the neuromuscular and neuroglandular junctions of the parasympathetic division, as well as the cholinergic junctions of the sympathetic division. The effects of muscarine, they last longer. than the nicotine receptors, and they can cause either an excitatory or inhibitory, depending on the activation or inactivation of enzymes associated with these systems. Muscarine is the active ingredient of the shroom. Some species of mushrooms have been found to contain chemicals that can elicit some type of response, and these can be abused. And whether they're making tea out of these mushrooms or just eating them, they can end up with a large amount of muscarine, which could bind to these muscarinic receptors and cause premature sympathetic and parasympathetic activation. So salivation, nausea, vomiting, diarrhea, constriction of respiratory passageways, low blood pressure, as well as low heart rate, which is bradycardia, can all be caused by muscarine poisoning.